I'm Paul Corrigan. I'm a management consultant and executive coach in the National Health Service, and what I'm here today is as part of a project with an organisation called NESTA, who's looking at developing co-production in the National Health Service. Most healthcare systems have a very straightforward idea of how value is created, and value is created by medical staff, their kit and drugs, and if you want to have more value, then you need more medical staff and more kit and more drugs, and that's been sort of the remorseless way in which healthcare has worked in most developed countries, and including in this country. The problem now is that the level of demand for healthcare is going up, and virtually nowhere can we afford to go on spending more money on more kit, more drugs and more medical staff, and so therefore we need to find another way of producing value. And what we're suggesting is that in other industries value comes from customers, and in this case from patients, and what we need to do is uncover and unlock the assets that patients have. The project's called People Powered Health, and the name is sort of on the tin, really. It's an attempting to get people into much more power over their own health. And the issue is that about 2/3 of the expenditure of the National Health Service is spent on people with long-term conditions, and these are conditions that people have usually for the whole of their life. And there's 15 to 16 million people with these conditions. And because you have a condition for a very long period of time, perhaps the whole of your life, you gain an expertise on that, in a way which you don't if you're having a hip replacement. And so how do we use the knowledge of that expertise that 15 to 16 million people have got? How do we treat that as an asset to work with is what the project's about. In Newcastle, the project is working with general practitioners, with people who have a long-term condition for quite a while. And for a lot of GPs, the experience of these patients who are sort of moderately ill and have been moderately ill for many years is sort of a revolving door. They keep coming back again and again and again. And again, because most of their illness is to do with day-to-day experiences and not necessarily drugs. So what's happening there is the GPs are prescribing a relationship with a voluntary group, and a relationship with a health trainer. So the health trainer, you say, the GP, I'm really sorry you've got arthritis, we've tried all the drugs, you'll keep those drugs. The health trainer will now come and talk to you about going in a walking group. And so the health trainer organises some community organisation for you to work with. And we believe, this is early days, a lot of these, but we believe a lot of this is going to be utilising other resources to save NHS resources, and the main other resource we're utilising is the people's activity themselves and supporting their carers, but also the assets that are there in the community. It is looking for these sorts of assets to get people better, really. That's the interesting thing, and it's in a lot of places, getting people better has stopped being what the health service is about, and it needs to become what it's about again.